Okay, so here is a poured upper model of a patient. It has been poured into a base former, and we're going to pull the model from the base and the impression. This type of impression is not sensitive to being left for a period of time. This material is it's called vinyl polysiloxane, or VPS, and so this type of material you can pour the model and then let it sit overnight. It's a little easier to pull these if you run some water over the impression. It helps it to release from the stone a little bit better. So we'll get some water going here. Pulling it from the base is pretty easy. Once you get that pulled, just make sure you don't have any leftover stone particles. Every once in a while, I like to spray Mizzy on the base because it helps to kind of keep it a little lubricated, and it also helps to get some of these leftover stone particles off. Back to removing the model from the impression. You have to just carefully start lifting it around the edges wherever you can get a grip on it. Oh, that came off suddenly. So that's your poured model ready to be trimmed. And this is a lower model that's been poured in an impression. Same impression material, the VPS. And you can see there's a little bit of stone that's kind of overlapping the impression here and a little bit over here as well. That's usually going to make it pretty difficult to pull the model. So it's good to take an instrument like a lab knife. One of these is usually pretty good, and just break that material away so that it's not gripping the model too tightly onto the impression. So just anywhere that it looks like the model might be locking onto impression material, it's good to trim some of that stone away. Got most of that stuff trimmed away. Okay, so the first thing I want to look at when getting ready to trim models is how level the occlusal planes of both models are with the base. And in this case, we're pretty close on both of them. I can bring that up just a touch. And we have to look at them both in the anterior and also check them from the side to see how level those occlusal planes are. And both of those models are not bad, so there won't need to be a lot of adjusting of the angle of the base in order to parallel it with the occlusal plane. So now we're ready to trim the upper model. We'll turn on the model trimmer and turn on the water. I'm gonna do a little bit of adjustment of the angle of the base, that is. So I'll get this right up against the wheel, and I'm trying to reduce the thickness of the base in this area, so I'm going to put pressure over here. And we can have a look at it again on the platform, and I think that looks good. Yeah. First step is trim the back edge of the model, and this is an interesting one because this patient has more teeth on the right side than on the left side. We don't use the back teeth necessarily as the guide for how to trim the back of the model. We want to use like the canines or a pair of teeth that are symmetrical to kind of guide us in how to trim this model. So we want the base to basically be, or the back of the model to be parallel to a line that goes through the canines for this patient. So we'll get that up against the wheel. And what am I doing there? Maybe a little bit more on the left. Okay, so sometimes when you have some thin stuff around the edges, you can just break it off like that. We've got that pretty parallel to the K9s, which are a good reference point for this one. And then I'm going to trim the sides, and I try to pick a line that's about parallel to the posterior teeth. So you get up against the wheel, set it parallel like these teeth. Okay, so there's a nice line on the one side, same thing on the other side. Okay, we got our sides done. Now there's going to be a little angle on both sides of the back to get rid of this stuff sticking up. And I'm being very careful not to get too close to the back tooth there, the molar. We don't ever want to trim away tooth structure when we're trimming a model. And then we'll do the front. And you can see this has this angle from the base former. It's a little bit off center, so that's probably going to be trimmed away differently. And these two angles are basically like, you can think of it going from the central incisor to the canine on both sides. That ends up being a little different for the lower model. The lower model is just curved across the front here. So I'm getting in somewhat close, but never touching the teeth. And that's about it for this model. Let's get it rinsed off. So that's basically what we want it to look like. A lot of this stuff is going to have to be hand trimmed away because it was getting in a little bit close to the teeth, but we can work on that once the model has dried. Looking good. Here's the trimmed maxillary model, and we have a little bit of extra stone that's kind of getting up in the way of the view of the teeth. This model is actually going to be scanned for orthodontic treatment, so we do need to have a real clear view of all of the tooth surfaces from kind of all directions. So I'm going to use a lab knife to trim away some of that excess. And the base was very thin on this, so I just took away a little bit of it. Not ideal, but it's not the end of the world. So just keeping the blade of the knife kind of parallel to the bottom of the vestibule and making sure not to score the model. You can see how I'm holding this with, a good thumb rest, and I've got the knife in a death grip because I really am putting quite a lot of force on this, but I have to be able to control it, keep my model in pristine condition. I'm going to come around and just trim off a little bit of this stuff too. And this is lab stone, which is a lot easier to trim like this than dye stone, which is what many of our models are made of. So that's what we want it to look like to give us a little more clear view of the teeth once it's trimmed.